Hello, I'm Judy Beamer, one of the Assistant Directors for Hospital and Clinics. Thank you for selecting UC Davis Children's Hospital. Your child's comfort and well-being are important to us. We will work hard to provide excellent care to your child. If you have any questions during their stay, please feel free to contact us.
Welcome to Davis 7 Pediatric Unit, located on the 7th floor in the Davis Tower. We care for children from newborn through adolescence. For safety reasons, it is a locked unit. Upon entering the unit, you will see the front desk. Here you can find the charge nurse and the unit clerk. They can answer questions and be a valuable resource throughout your child's stay. Many people may participate in your child's care. The medical team is led by the attending physician. The attending physician is responsible for all the medical care your child receives while in the hospital. Residents caring for your child are licensed doctors training in specific areas of medicine. For example, pediatrics. Your child may also be seen by consulting doctors. These specialty physicians advise and make recommendations to the primary team on particular aspects of your child's care. If you feel you're receiving confusing or conflicting information, please clarify with your child's attending physician. UC Davis Children's Hospital is proud of the fact that all patients are cared for by registered nurses. Your child's primary nurse will introduce herself to you and become familiar with your child's condition, medical needs, and personal preferences. A primary nurse works with you to develop an individualized plan of care for your child and communicates this plan to the rest of the nursing team. We know the most critical person in the healthcare team is you, the child's family member. We want you to be an active, involved, and informed member of your healthcare team, so we encourage you to learn as much as you can about your child's diagnosis, tests, treatment plan, and medications. As you think of questions, you may want to write them down so you won't forget to ask them later. If your nurses know what your concerns are, they can help find answers for you. UC Davis is a renowned teaching hospital. Medical and nursing students may be involved in your child's care. Medical students are working under both residents and the attending physicians, just as nursing students are supervised by registered nurses. Other hospital employees may also be involved in providing care. These might include clinical nurse specialists who focus on helping with particular conditions and treatments, social workers who can assist with the burden of hospitalization, pediatric dietitians can help with children's complex nutritional needs, physical, occupational, and speech therapists, laboratory technicians, hospital volunteers, and others. All hospital employees wear identification badges with their picture, name, and department. It's okay to ask for ID. We encourage you to call a nurse if approached by someone without it. We have many support services available to help make you and your child comfortable. The Child Life and Creative Arts Therapy staff is trained to help minimize the stress of hospitalization and illness. They can help your child to better understand their hospital stay, upcoming procedures, and illness. Child Life staff can provide activities to support coping and encourage the expression of feelings. Your child's education may also be a concern during prolonged hospitalizations. UC Davis Children's Hospital has a school teacher on hand during the school year. The teacher can help with the schoolwork your child's teacher sends in or assist with other education requests and needs. Hospital chaplains and pastors are available to offer comfort and support, provide counseling, prayer or sacraments, and discuss ethical decisions and concerns.
Thanks for calling. Patient information is considered confidential and can only be shared with parents and guardians. We appreciate you letting family members know. Upon admission, an ID band was placed on your child's wrist or ankle that contains important information. For safety, this must remain on until your child is discharged from the hospital. At UC Davis Children's Hospital, we have electronic security systems and other precautions in place to help protect infants and children. To assist us in providing the safest environment possible, we ask you to refer to the pamphlet, Safeguarding Infants and Children in the Hospital.
What can my child eat is a question often asked.
For children over 1 year, a dietary host will call or visit every day to discuss your child's meal choices. You may refer to the menu provided, usually with your child's first meal. 3 meals are served daily. If your child is hungry between meals, additional snacks or beverages may be available. Choices will depend on your doctor's orders.
At UC Davis Children's Hospital, we do our best to make sure your child's room is safe, clean, and comfortable. The bed can be adjusted, Side rails come down with a simple lever. Each room has a closet and a bedside table for storage of personal items. Special blankets and stuffed animals that comfort a child are welcome. Many children prefer to wear their own clothing or pajamas. Valuables and things that cannot be replaced should be left at home. The call light system is a simple way to contact your nurse. Please feel free to page for any needs. The TV has regular channels and on-demand patient education video channels. DVDs can be checked out from the playroom. In consideration of other patients in the room, please keep your TV volume at a reasonable level. You can make local calls on the telephone located next to your bed. To do this, press 9 before dialing your number. Family and friends can call this bedside phone between 8 a.m. and 10 p.m. using the number posted in your room. Cell phones may only be used outside or in designated areas because they can interfere with important medical equipment. For your convenience, Davis 7 does have free Wi-Fi. Because we believe parent support can facilitate the healing process, a sleep chair is provided, but due to limited space, we ask that only one parent spends the night. Our housekeeping staff will appreciate if you put your sleep chair up by 9 in the morning in time for room cleaning. Because the hospital can be a busy place, the pediatric unit observes quiet time from 1:30 p.m. to 2:30 p.m. This quiet time has been set to encourage children and their parent to rest or to do a quiet activity at bedside. We suggest TVs and lights to be turned down, and the hallway lights will be dimmed. You can support this by informing family and friends of this and ask them to visit early in the day or after 2:30. Toddlers and infants are provided cribs. For your child's safety, please keep side rails up and the canopy down when you are out of reach of your child. There are times it becomes necessary to isolate patients for different reasons. Please be assured that the decisions are made with careful consideration and knowledge, and always have the patient's and unit's safety in mind. Isolation decisions would never be made that could put a patient at risk. For the protection of your child and others, please remember to wash your hands or use the hand sanitizer before entering and when leaving your child's room. It is acceptable to ask hospital staff about hand washing. Davis 7 has 4 nurses stations. The center area is for staff only. If you should need something from this area, a staff member would be happy to assist you. To the right of the entrance, there is a family room with a computer which adult family members may use to check email. A microwave and supplies to make you a fresh cup of coffee are available. You will also find a refrigerator to use. Please label your food with your name and the date. Restrooms for visitors are located near the entrance of Davis 7, next to the family room. The restrooms and patient rooms are for patients only. We are often asked about siblings, and yes, other children may visit as long as they have no fevers, rashes, or colds and are supervised at all times, but under no circumstance may they stay overnight. On that note, we appreciate if any family members are sick, please ask them to save their visit for another time. And now, a word about balloons. Latex balloons are strictly prohibited because they pose a serious, potentially life-threatening health risk to staff as well as patients. Mylar balloons are just as cheerful and non-allergenic. If your child is feeling well, they are invited to spend time in the playroom. There are a variety of items available such as games, toys, and art supplies. Regular groups and special events also occur in the playroom. Please see the weekly calendar for scheduled activities. For the older child, 11 years and up, there is a teen room. This space allows the opportunity to access a computer, play table games, and video games.
Sometimes children require medical procedures, such as IV starts or blood draws. The treatment room is where these take place. The treatment room keeps the hospital room a safe space, so your child is able to rest and recover without the worry of something painful happening in their bed. Some tests and procedures take place in other parts of the hospital. We encourage you to accompany and support your child whenever they are off the unit. Sometimes a child may need to go to the Pediatric Intensive Care Unit, or PICU, located on the 10th floor. The PICU has medical equipment along with specially trained doctors and nurses to care for critically ill children that require continuous attention or specialized monitoring.
The Pavilion Cafe, located in the pavilion lobby, serves breakfast, lunch, and dinner, as well as a limited late-night menu. Due to infection control policies, patients are not allowed in the cafeteria. Guest trays are available for parents for a nominal fee. Please ask if you're interested. Questions about parking are common. There are parking structures adjacent to the hospital and short-term parking outside the pavilion lobby. Charges are by hourly or daily rates. If your child will be here a couple of days, it may be cost-effective to purchase a multi-day pass from the parking kiosk. Additionally, there is a free shuttle that runs to Light Rail. The Ronald McDonald and Kiwanis Family House offer low-cost lodging for families who have traveled from outside the greater Sacramento area. Each house is located on hospital property and provides a comfortable place to stay. Both offer free parking to guests, a food pantry, and other services. To request a room at either of the two houses, please ask a social worker or your nurse to make a referral for you. Kiwanis Family House also has hookups for families bringing their own RV. During regular hours, the hospital shuttle will take you from the main lobby to either house, and after hours, a van can be called from the lobby. There are a few hotels within easy walking distance. A complete list of area hotels is available upon request. Many offer a discount to UCDMC patient families. Planning for your child's discharge begins as soon as he is admitted to the hospital. Your healthcare team can inform you of the discharge goals or criteria for your child. Our discharge planner may assist you with equipment needs or home health services. You will be given a discharge instruction sheet detailing your child's follow-up care. It is helpful to bring these instructions to your child's doctor's appointment after release. Your child may be prescribed new medications. It's very important to make sure you understand all of the instructions. If you feel unclear or have questions, please ask your nurse. It is often easier to pick up and have your medications before you leave the hospital. The discharge pharmacy is located in the pavilion lobby. Many medications specifically for children are here. If you would like to use your local pharmacy, let your doctor know. When you leave, don't forget to collect your personal belongings from the room. And a note on safety. California law requires all children under 8 years of age or under 4 foot 9 inches must be transported in a child passenger restraint. Remember to have your car seat when you're ready to go home.
We promise to do everything we can to make your child's stay here as comfortable as possible with a speedy recovery. Thank you for choosing UC Davis Children's Hospital.